how long before you start to gain more flexion after a manipulation under anesthesia?
The question is, after doing something called a manipulation under anesthesia, how long until you see a better range of motion, essentially? For those who don't know, a manipulation under anesthesia is something that fortunately is needed pretty rarely these days, but on occasion, if a patient is having a tough time with stiffness after surgery, we will put them under anesthesia very briefly and manipulate the joint, which means gently force the joint into better range of motion in an attempt to disrupt some of the scar tissue. This is typically done without making any incisions on the joint itself. So it's a closed procedure. Usually, if it's successful, during the procedure, you, meaning me as the doctor, would see improvement immediately. And the question would then be, how quickly will the patient see that after anesthesia is worn off and and they're working on it themselves. It's variable. I've had some patients who have that procedure and almost immediately they have quite a big change in their amount of motion, and others where despite progressing quite a bit during the procedure, their actual functional benefit occurs on a slower basis. So it can really range, but oftentimes you will see an initial fairly sudden improvement and then a delayed continued improvement as you continue to work with exercises and therapy.